My name is Elise Wright, and I'm president of the Vizsla Club of America Welfare Foundation. We are the nonprofit arm of the parent club, the Vizsla Club of America here in the United States. We are very excited to launch this webinar program. This is our very first one. So thank you all for jumping in. We may still be working out the kinks, so be patient with us. The Welfare Foundation, as many of you know, our mission is to focus on the health and welfare of the Vizsla breed. And also, before I go on, if everyone would mute their computers or phones or whatever, that'd be great. Thank you. Our mission is threefold: to fund health research, to benefit the Vizsla, to support the purebred Vizsla in rescue, and education. We want to share what we are learning about the breed with all of you. And this survey that we started in 2022 and ran through November of 2023, it is designed to give us lots of information about the Vizsla breed. We really hope to get a big picture. And what we've learned is there's so much more to learn. So tonight we're going to focus on the living dogs. And this webinar, if you will, is a highlight reel. And we're going to dig deeper as we go along in the coming months. And the other thing that's significant about the survey's design is that we are able to come back to participants and ask follow-up questions about certain conditions or how age relates to this or that. So we're very excited, and that gives me the opportunity to tip the cap to our survey designer, Dr. Krista Schrader, who is an epidemiologist by trade. So we're very lucky to have her on the Welfare Foundation board. We also have several of our consultants and fellow board members on the call, and thank you all for what you do for the Welfare Foundation. And then I'm going to turn it over to Kathy Rust, who is our secretary. She is the AKC delegate for the Vizsla Club of America and a platinum breeder of merit. So Kathy, all to you.
Welcome everybody. And please, as I go through this, I'm going to be asking Krista to jump in when I say something wrong. So we're going to start off by just saying a few little housekeeping things. If you have a question, please type it in the chat. Chat will be monitored, and if we're not getting to you, you can start waving your hand frantically or whatever. But if you can type it into the chat at any time, we will stop on each slide and answer any questions that they have. So please ask questions. Again, this is just going to be a very beginning overview, and I'm super excited for this to start. So I'm going to go ahead and start sharing. Okay, first of all, can everybody see the screen? Hoping that's a thumbs up. Okay. This health survey went on for approximately a year and a half, I think it was, about. But anyways, we were really excited to finally get one out because it had been quite a while since our last one, and we're looking forward to many more in the future. As stated earlier by Elise, this is just an overview of when the Welfare Foundation was established in 1998, who our founders were, and who our current officers and directors were, as well as our veterinary advisory committee and our public health consultants. We throw questions at these people all the time and ask for input. We do not do anything in a vacuum. We're always here to share information, to help you out. You can send us questions and we'll help you find research on it, and we'll figure out where to go. We're going to jump into a little bit of the demographics. There were 2,983 unique individuals that submitted surveys. Many of these people had multiple dogs, which added up to 6,477 of those individual dogs that were either the surveys were completed or they were partially completed. So the overall completion rate, because I think some people got tired after the fourth or fifth dog, was 64.2%, which we were very happy with. Of those 2,983 responses, 700 of those were our VCA members, which is a really good percentage of them, and we were thrilled. That opened up to about 25% of the overall survey pool. Of those, 537 of our 2,900 were breeders, which gave us good input. And just kind of going back to our past surveys, our population survey in 2019 had about 1,500 dogs less. So we were so thrilled with this one. Today, we're going to concentrate just on the living dog portion. So some of the numbers may seem a little bit off because you're thinking, my dog died of that 5 years ago or whatever. These are the dogs that were alive at the time they filled out the survey. Of those, 1,551 of them were females, 1,249 were males. Of those, we had intact 1,319, and spayed and neutered were 1,460. And we had 30 that had ovarian or vasectomies. So we had included in our survey, which we are not talking about tonight, 1,219 dogs that were deceased. So then we kind of just broke it down into some broad categories to begin with when we started our initial drill down. We wanted to find out what were the top 10 conditions of our currently living dogs. And as you can see from here, allergies and skin conditions were the top two, followed by ear conditions, which also may be considered allergy related or skin conditions, oral cavities, digestive conditions, cancer, infectious diseases, urologic conditions, orthopedic conditions, or trauma. So again, let's look at those top three: allergy, skin conditions, ear conditions. There may be some overlap there. Those are things we don't know at this time, but we may look into in the future. When we look at our allergies, we have, and look at the percentage of those, 567 dogs that completed our survey, which is 20.8% of them, said that they had an allergy of some sort. We need to be concerned about that. We need to think about why that's happening. I mean, a fifth of our dogs having allergies, something to be concerned about. Were they environmental allergies? 14% of those were. Food allergies? Was it an adverse reaction to a stinging insect? Was it unspecified? Was it a reaction to a vaccine, anesthesia, allergic reaction to medication? As you can see from the left-hand side of the screen, you can see how that broke down into what the biggest concerns were. And a quick check. This is, like I said, big picture that we're looking at right now. So definitely, if you have questions, again, please put them in the chat, and that is being monitored. So if we have any questions, we can stop on this slide and answer a question if we have one. And I would just ask that either Elise or Krista ask the question. And okay, on to the next slide. Allergies. This one, again, kind of caught me. I was surprised that many of our dogs actually had concerns about some sort of allergy. Now, I will go back when I very first started in the breed. And as a breeder, I was said that when Vizslas first came over to the US, there was a lot of immune problems. So if we look back to the original dogs, maybe we're on a good swing that we only have 20%. It's hard to say, but we need to get this number down over the next couple of generations. Skin conditions were the next number 2 on our list. Lipomas, skin tags. Skin tags, I'm always curious about if people considered their Futaki horns to be skin tags or not. That's kind of a question that I had. Are they skin tags that are on the chest, underneath the legs, in the armpits, all those areas? Black spots on eyes, lumps, cutaneous cysts, chronic itching, hypersensitivity or allergic skin disorders, dermatitis, hair loss, interdigital cyst, demodexic mange, sebaceous endonitis, and sclerostic mange. Sebaceous endonitis, out of 470 dogs, 1.2% of them, or 0.8% of them say that they have sebaceous endonitis. This, again, in the past was a huge, huge issue in our breed. And I am hoping that that is a downward trend that we will continue to find in the future, that that gets lower and lower. Every time I look at these results and these percentages, I have more questions, more things that I want to ask. I want to get down to more details, which is why, again, we did this survey to begin with, is to have things that pique our interest, to get more information so that in the future we can hopefully do research or find studies to decrease the amounts. Ear conditions. Pretty self-explanatory on these ones. Again, I'd like to know how many of these dogs spend a lot of time in the lake, how many of these dogs are in the field a lot, going into ponds, if they also have allergies, if there's crossover, things that require more of a deep dive.
And Kathy, that's what I was going to say. We can easily look at what proportion of these dogs also have allergies. You know,
Awesome.
So something like that in the deep dive. Yep.
Yep. So again, this is just our highlights tonight. And thank you, Krista, for putting that in there. I can see her cogs in her brain just going like crazy right now. Oral cavity mouth conditions, fractured teeth, retained puppy teeth, cavities, overshot, undershot, tumors, melanomas, those types of things. 175 dogs, or 6.3%. With the retained puppy teeth, I'm hoping that breeders are tracking that in their litters for future reference and follow up to find out if any of their puppy owners have to have those actually pulled. And if you're seeing any sort of familial lines going from that through sire or dam sides of the house. Me as a breeder, I'm curious about retained puppy teeth. Because oftentimes retained puppy teeth can go into a narrow base jaw, possibly overshot, undershot in the future, just something to be aware of. That's kind of my input on that. Whether it means anything or not, I'm just tossing it out there. Digestive system conditions, anal glands being the top one here. I'm curious on that one. What do they feed? Are they feeding raw food, kibble? What types of diets are they? Are they dogs that they have to express on the regular basis? Chronic colitis, diarrhea is also up there. The rest of them are pretty, in my opinion, probably normal for all breeds of dogs that have them at some point in their time. The pancreatitis, a question I would have on that is, at what age did they develop it? Was it as a young dog? Was it as an old dog? Was it due to the same time as an illness or other things? Chronic regurgitation or vomiting. Of those dogs that have that, again, I'm throwing out questions that I would have. These are not anything that we've been told. My curiosity would be, is there any megaesophagus involved with that? Was there other things that is a cause of it? Was it diet related? Did they also have the diarrhea, the chronic colitis? Weight gain before or after being spayed or neutered. Is there a thyroid issue? All those types of things. But again, anal glands being our top digestive condition. Cancer, big, huge highlight on this one. This is data with the dogs that were currently living, not dogs that have passed. Dogs that were currently living. So the diagnosis, yes.
I apologize. We did have a question on the digestive.
Okay, you go,
slide.
girl.
Yeah, so just on the anal gland issues, Beth Nash asked, would age be a factor? And I know you commented on that. We did ask whether they experienced it in the past or are currently experiencing it, but we did not ask age of onset. So we don't have that information for that in this current survey. However, if this is something that we decide rises to the level that we want to ask additional questions, we can reach out to these 72 people, at least the ones that agreed to be contacted, and ask them deeper questions on that.
Good question, Beth. Thank you. Hopefully that answered your question. Cancer, again, 143 dogs had this at the time. Oh, we have somebody raise their hand. Carol raised her hand.
Oops.
She said, oops.
Oh, okay, that's okay, no problem. It happens, I do that all the time. I start waving. Anyways, cancer, currently 143 dogs were alive that had been diagnosed with cancer at the time of filling out the survey. And sometimes, as stated in our little note there, we often don't know that cancer was a cause of death until a confirmed diagnosis, I should say, until after death. Currently, of the number of dogs that reported having cancer and still being alive, it was not surprising that mast cell tumor was the number one.
Mast cell tumor.
Yeah, that mast cells were the top type of cancer in dogs that were currently living, with 70 of those. The rest of them, as we go down, melanomas 21 or 0.8%. Everything else was less than 1% across the board. Unspecified, they just think their dog had cancer. It wasn't a confirmed diagnosis of what it is. Soft tissue carcinoma, sarcomas, hemangiosarcomas, fibrosarcomas, histiocytic sarcoma, lymphomas, on downward. But again, for dogs that were alive, mast cell tumors were the number one cancer. Urologic conditions. Not surprised that we're having urinary tract infections. Again, raises more questions that we can probably go up to that. 4.6% of our dogs have suffered from of the alive dogs have suffered from some sort of urologic condition, with UTIs being number one. Curiosity with that is it juvenile UTIs, urinary incontinence, how old were they when they started? Spay incontinence, the same types of stuff, stones, chronic kidney failure, was it secondary to another primary cause?
Ooh.
Just lots of questions.
Okay. Okay.
Eye conditions. 70 dogs, or about 2.5% of the dogs that completed the survey that are currently alive, had some sort of diagnosed eye conditions, with cataracts being number one at 1.2%, or 33 of those 70 dogs. 1.2% of the overall population, I should say. So cataracts doesn't surprise me. When were they developed? At what age? We didn't have anybody that put on here that currently had an alive dog with suddenly acquired retinal degeneration. So possibly some of those were in dogs that have already been deceased, because that does occasionally pop up in our breed. Iris atrophy. I recently myself had my 13-year-old dog was just diagnosed with iris atrophy, and has great vision, just her iris is no longer there. At age 13 that happened. So things to keep it, just to be paying attention to and knowing what are the top conditions. Heart blood conditions, heart murmurs. 53 of the 66 dogs. So heart murmurs, what grades were they? At what age were they diagnosed? Secondary to any other diseases or afflictions? Overall, I felt that the dogs that were currently alive, that this was a fairly low incident rate, which I felt was really, really good.
Also really low for DCM too, Kathy, which was something that we were, in the past interested in. Yep.
Yes, yes. So yeah, I felt that this was really good for our breed compared to some other breeds such as Dobermans that and Bernese Mountain Dogs and other breeds of dogs that heart conditions are their number one killer, which is really, really sad. endocrine conditions, hypothyroidism, Cushing's disease, Addison's. Only 44 dogs. Again, was surprised. I expected this number to be higher, and we're going to talk about this a little bit more. So my question on this one is, I wonder how many people either we're doing a really good job of testing or we're not testing enough. Because 1.6% out of a pool this big of living dogs is really low and really a good thing. And I hope that that we're finding that this is the truth. I thought it would be higher. That's just me. Any questions on this one?
I thought it would be higher too, Kathy, especially since one of those hypothyroidism dogs is mine. So anyway, I agree. And I do wonder, if we were to ask people specifically this question, as opposed, this was a pretty decent sized survey, were there people that got a little fatigued by the time they got here? It just seems to me like it's got to be lower than it reasonably is. But
yeah, I kind of got the feeling that this one was a little bit off too, but you're right. It could be that they were too far in there. This one I took as an amazingly good outcome, and hope again that we got people that have been concerned about epilepsy. Only 1.4% of our currently living dogs were suffering from a type of neurological condition. Seizure disorder brought on by something else, but only epilepsy was only 1/2% of the overall living dog population says that they have epilepsy. I find that this is a trend in a right direction and makes my heart happy. Vestibular syndrome, I was surprised in that one. I expected a few more dogs to have reported that because I have heard about it in quite a few elderly dogs before. I was also a little bit surprised that we had so few that reported cognitive dysfunction in elderly or senile dementia. Because we seem to have,
the dogs are, passing on
yeah,
or dying shortly after. Do you know what I mean? And it might just be a artifact of that. I don't know. Just thought.
Yeah, I think good points. Good points. So this kind of was really interesting. This was just a really quick snapshot of behavior, and we're going to get much more into this in the deep dive. So 20% of the
I
people.
apologize, Kathy. Beth had another question.
Okay, go ahead.
Says, we see more cognitive stuff when we look at deceased dogs. And I think, yes, we did have dementia and senile dementia, cognitive dysfunction as a contributor to why they might have passed on. And so we will be able to look at that.
Awesome. This is just a really quick snapshot of behavior. These numbers, in my opinion, are pretty significant of percentages of the overall number of dogs in our breed that people feel have some sort of behavior problem. Now, this is definitely we're going to require follow-on surveys and deeper dives and more questions, because everybody has a different view of what excitability is, what distraction is, some of those things that requires more detailed, specific questions. And also it's amount of exercise that the dogs get, age of the dogs. There's so many things that goes into this, but these percentages of, many that are over 10% of our living dogs that people say have an issue, that we need to be very cognitive of and be really considering temperament and personality traits when we're breeding dogs. And how we're managing it. Maybe we need to be looking at how we're educating our puppy owners on how they're managing their dogs' psychological well-being from a puppy on. So are we creating these problems? Are they truly genetic problems? We could have a deep, deep, deep discussion about many of these things. Some of them are definitely inheritable conditions. Others of them may be man-made. Others may be a combination thereof. But I think you just need to take a moment to actually look at all of these percentages. General lack of confidence at 14.3% is concerning. Suspicions of people, not everybody, they don't have to like all people, but aggression, suspicious of people, general lack of confidence, those kind of are concerning to me. Car sickness, emotional urination, sometimes they grow out of that. I also have one of those. I've had a couple of dogs when they've reached old age that I call them, they have shiny floor syndrome, where they don't like to walk across shiny floors, but that might be eyesight. But everybody has a slightly different, again, opinion of what their level is where they would say that their dog is too excitable. Are they normal for our breed? Is it way over the top? Again, I think we can have many, many, many discussions about these, and we're looking forward to talking with some of our panel of experts on what other questions we should be asking to try to get to the root cause of some of these behavioral issues. Any comments from our viewers on this?
Well, Kathy, just really quick to add to this. So we did have additional detail on each of these to kind of guide people towards whether they thought their dog had this condition or not. And this list was taken from a survey tool that is used for seeing eye dogs for helper dogs. So that's where we took this from. So in some ways it's appropriate. In some ways, these might be things that are more okay in our breed than it might be with a helper dog. So we did the best we could with the tools we had for us, but I just wanted to say where this came from.
Awesome. Thank you, Krista. This is exactly why you're on, because you are the expert behind the survey. Okay, any other questions about behavior right now? Okay. We threw this one in here because...
One now.
Okay.
Sorry, one just popped up from VSO, who I'm not sure who that is. Stubbornness is a label that people attach to a dog that isn't doing what the person wants, usually symptomatic of people who don't have a good understanding of how to shape a dog's behavior.
Good input.
I think more of a comment. Yeah.
Perfect. Thank you for that. We threw in here some information about OFA health screens since the beginning and kind of wanted to toss it back to some of the stuff that we were seeing in our survey. So one of the highlights on this, you can kind of see it. We've done almost close to 20,000 hips with 92% of them being normal. We don't know how many abnormal hips are not being sent in, and hopefully people will be, if we do some drill downs into our orthopedics, people will have been at least honest in our survey and just said, hey, yes, I've produced hip dysplasia, because sometimes when we don't see abnormal results or people don't send them in to be recorded, it becomes, the numbers become a little bit skewed. We're super happy to see that our elbows x-rays have been going up, the number of people that have done it. Thyroid. Thyroid, I want to talk about for just a second, because again, I was surprised that the numbers were pretty low. Thyroid in our breeding animals should never, ever, ever be a one and done. Thyroid's one of those things that can come up and bite you in behind if you're not paying attention to it. I know in English setters right now, thyroid is a huge issue with them. And it started happening that dogs were developing it older after they were done breeding. And with each generation, abnormal thyroid results were showing up in dogs that were younger, and a greater number of them each generation. I just wanted to kind of jump out there because at some of the Canine Health Foundation meetings and stuff too, they're seeing thyroid issues kind of overall popping up. I really want to encourage everybody out here who's bred dogs to consider doing an actual thyroid panel, doing an OFA thyroid panel or a complete panel at least every 3 years on your dogs until they die. I recently myself just sent in a thyroid test on a 13-year-old, 2 9-year-olds, and a 3-year-old, because we need to know if they develop thyroid conditions at any point during their lives so that we can start paying attention to their offspring. This is just my foot stomp. Interesting too, you can see here too that we've already had with dwarfism, disproportionate dwarfism, 65 normals and 13 carriers already put in there. So that's another test that's going to be obviously very important for us to continue to do. Anyways, this was just kind of throwing in here as a, this is how many dogs have been tested. These are what the current results are. Want to also footstep and say how thankful I am for all the people that let their dogs participate in our DNA blood draw for the DNA chick blood bank at OFA. We over doubled the amount of Vizslas that are currently in the registry from 94 to 222. This is such an important thing. I found out from OFA that last year alone, 6 research projects were able to get all of their samples using a variety of breeds directly from OFA when the genomic information had already been analyzed and all they needed was the computer data. It's a wonderful program that will just keep on giving for the life for our breed for decades to come. If you haven't had blood drawn and sent to the OFA chick DNA databank, please consider doing that. It is so incredibly important. And if you do it, try to get 3 or 4 dogs at a time to do it because the shipping is not cheap. So if you can get a group of people to go into a vet clinic and get all your blood drawn and sent and only have to pay shipping once, that's awesome. And again, yes.
Sorry, I don't mean to interrupt.
You interrupt away.
Well, we just had a question about, and you can get to it in a minute, but we did have a question about equivocal thyroid and what did that really mean?
It means it's not really, it's borderline. Equivocal means borderline. And actually, I think we have Dr. Heinhold. Is she on? Or one of our veterinarians that might want to jump in? But anyways, it means that it's borderline. It's kind of not in the place where it meets the qualifications for being completely normal, but it's not truly abnormal either. Usually equivocal means you need to redo it. If it is with a female, you want to try to do it 12 weeks from the day that she starts her cycle. So 12 weeks after she starts her cycle. And for a male, I usually been told to wait 2 more months and try it again too, because it could just be something that's happening at the time. They might have a test that's slightly off, but you should not do a one and done if it's equivocal. You should definitely retest.
And Kathy, oh yeah, sorry. Ask if that answered the question. That's fine.
Okay.
I didn't mean to.
No, does that make sense to the person that asked the question? It's kind of like it's in the middle and it's not really one way or another. They can't make a full determination. So definitely retest if you get one.
Yes, that makes sense.
Okay.
And Beth said, and I've been told an equivocal can happen after intense activity. So that's interesting also.
Mm-hmm.
And then Rhoda does have a question for you. So she says, do you know if the blood sample or the blood submitted for the OFA University of Missouri HIP study went into the database?
Yes. That is a yes answer on that. I had 2 dogs that were part of that study, and theirs is also in that database. All the dogs are there. They just ran and did the genomic sequencing of it, and then it just added into the database. So when researchers go to the OFA, they're not actually physically getting the blood. They're getting the genomic information that has already come down when they've analyzed the whole sequence. We're going to talk a little bit about reproduction. So this was a lesson learned for us, and Krista might have to jump in on this one. Um, when we did this, we asked if the dogs had the number of litters, had anybody whelped or sired a litter, and the answer was yes. But we didn't get it broken down into how many males and how many females produce these number of litters. It was just how many litters did your dog produce. So do not.
And Kathy, that's what we have right now, but we can certainly in the next round stratify by male and female.
Yep. So you can do that. So this was just the quick take now. So don't panic. We do not have girls out there that have been having 7+ litters. At least we don't think so. But of our survey, 411 of our dogs had produced at least 1 litter, with the great majority of them only having 1 litter, and some of them, assuming males, having greater than 7 litters. So interesting enough, like I said, 411 of the living dogs have had a litter or sired a litter. And we asked about dogs with congenital abnormalities, and there were 132 litters, or 24.8% of the litters that were produced that had at least one of these abnormalities. Eye abnormalities, cleft lip, cleft palate, cowlicks. That's just more of, dentition, esophageal abnormality, hearing, heart murmurs, liver shunt, neurological abnormalities, renal, reproductive, as in being cryptorchid, skeletal muscle abnormality, umbilical hernia, and other congenital abnormalities. We definitely need to drill down on some of these and find out more information. Like, for example, umbilical hernias. Did they need to be surgically repaired? What exactly were any of those? And some of these are the dogs that were born with. Krista, you're going to have to answer this question for me.
I know where you're going. Go for it.
Are they still alive? Are these dogs that were born with it still alive?
So this question was asked of the dogs that whelped or sired a litter. So this is their puppies. So that doesn't necessarily mean that these dogs lived. No. So, for example, there's 132 litters that we're looking at. And in these litters, there were these abnormalities. So
Okay.
Unlike the other analyses that we did that were at the dog level, this is at the litter level based on the living dogs that sired or whelped these litters.
Perfect. Thank you for answering that.
You're welcome.
So then we asked some questions about if your male or female had any reproductive disorders, and 60 dogs said yes, where they had mastitis. 16 of them, or all of these were less than 1%. Pyometra, emergency C-sections, retained testicles, false pregnancies. And again, I'm feeling that overall for our breed, some of these numbers are probably relatively low because people just haven't tested and don't know. And so, for example, some people with false pregnancies probably really don't know what a false pregnancy is in their female if she's intact, or they've never had a sperm count done on their male. Or the enlarged prostate, only having 5 of the dogs that, of all those dogs that at some point produced at least 1 litter, I feel is probably pretty dang low, depending on how. And then I would be curious to know of any, again, more questions I have, if any of those dogs that had bred a litter were then turned around and spayed or neutered, and at what age. So questions bring up more questions.
Well, and for example, Kathy, on that slide, we had less than 5 people say they had an elective C-section. I mean, I suppose it's possible. I mean, and only 8 that said they had an emergency C-section out of all of our dogs. So, I mean.
Yeah. So this, again, some of them the numbers seem like abnormally low. Did we not get the right people that reported? Did they not choose to put those dogs into the database? We don't know. But are things to maybe ask more questions about in the future.
Kathy,
Yes.
I just want to capture a comment made by Susan Mully, who's on the call. She is a vet, and she also suggested that when we do our drill down on congenital issues, that we look at whether a bitch was given folic acid during pregnancy, and did that impact the appearance of cleft palates or umbilical hernias.
Awesome. Great things to capture. This is why we love our audience and the people in our breed, because you guys keep us thinking and give us things that we know that we need to track for the future and questions. So thank you, Susan, for that.
And Janice has a question also, and I think this is a question for me. So, but if it is a sire or bitch who whelped a litter, could these numbers be double counted? Meaning, could owners of both bitch and stud be reporting the same cleft palate in that litter? I think the answer is yes. We'll do that analysis split by male and female, and so that will eliminate that concern, so we can see over the proportion of females we get this, over the proportion of males we get that. But since we have not identified the dogs or the owners, there's no way to know that. So perfect. Now we have had discussions, and we certainly will do follow-up surveys with our breeders, where we ask more detailed questions like that, and we'll be able to work through that in follow-up.
So what's the next step? Well, we need to figure out, do the deep dive into our cause of death reporting, and target date for that is mid-fall. What we're hoping to do is that through this process of doing surveys and everything else, we're really excited that we're going to be having hopefully quite a few more webinars and information on our websites and social media. Getting information like this helps us as the Vizsla Club of America Welfare Foundation know those things that we need to focus on to better help not only our members, but all owners and breeders of the Vizsla, to make sure that we are capturing and providing guidance, education, and support on issues that quite a few people face and things that are important to our breed. Also, these surveys really help us identify areas to focus our research funding on. And like I said before, membership education is focused on key findings. Right now, we in the Welfare Foundation are looking at up to, another 5 webinars within this next year. Some of the exciting stuff is some of our iconic breeders evaluating puppies for us, working on more health stuff, and doing another in-depth review of the additional information we're finding out from this health study. Our participants, that we were so thankful that of those people that completed the surveys, 85.9% requested that we future contact them for future on surveys, and 90% of the dogs of our owners of our deceased dogs opted in for future surveys also. We can't thank you enough for that, because if you answered a question a certain way, you may be contacted to provide more information, and everything you give us is 100% kept confidential, and we use the information in our database to help us figure out where we're going as a breed, if that made sense. I might have said that wrong. But anyways, you
said that 100% right, Kathy. The only thing I would add is that the email to reach out for a future survey would come from within our Alchemer platform, so within the secure system. And the only information we have about you or about your dogs, identifiable information, is that email address. So we're trying our hardest to even keep these follow-ups anonymized and not make any attempt to identify people or the dogs. So
perfect. So we wanted to throw one slide in here that made all of our hearts sink to our stomach, which was the leading cause of death, of course, for us. Of the 1,219 dogs that were entered into our database, half of them died from cancer, with the most frequent fatal cancers being hemangiosarcoma, at 35%, lymphoma at 13%, and mast cell from 12%. We definitely need to get a grip on cancer and cancer research, but this is so disheartening when you know that 50% of our dogs died from cancer.
Well, and if you look at it another way, 1 out of 5 died of hemangiosarcoma.
Yep, and 1 out of 5 died from hemangiosarcoma. So hemangiosarcoma needs all the research we can get and our support behind it. We were surprised too that neurological, including seizure disorders and stuff, really were 5%, with epilepsy being less than 1% of a cause of death. That is wonderful news for our breed, that epilepsy seems to no longer be as prevalent as it used to be. So thank you to the breeders for that. What's next? More deep dives into our data, the trends, the both good and the bad. We're looking at doing some sample of future analysis of the living dog base of vaccines and vaccine reactions, what we're doing with genetics and health testing, and definitely more detailed analysis of the behavior and temperament issues. And for our deceased dog database, we want to look at cause of death more and the age of that death, and the cause of death, especially due to cancer, at what ages, and again, how the diagnosis was received. With this, and I made a foot stomp when I was at the Nationals this year giving this presentation. If you have a dog, especially a younger dog, that dies at a relatively young age, if there's any way that you can do a necropsy on it and get the exact cause of death, it is a huge help for our breed as a whole. I know it's hard to think about doing that with your dog, but especially with undetermined, complete, for sure diagnoses, getting that done helps generations in the future, and I would really encourage you to do that. We're also going to, in our future surveys, we want to do more of our breeder surveys. We may do a just for breeding dogs, a survey just for breeding dogs. And as you can see here too, more of a deep dive into what's causing our allergies, diet, vaccine schedules, what is the cause of that, correlations between specific health concerns, if they were spayed or neutered at the time, orthopedic injuries, and then find common threads among long-lived dogs, what contributes to longevity. That's a really key interest to us also. Any more questions right now? I want to send out, as well as the entire Vizsla Club of America and Vizsla Club of America Welfare Foundation, a huge thank you to the VCA membership for all you did to support this survey. To all of our USA breeders and puppy owners, thank you for participating. For this go around, we needed to draw a parameter and we kept it within the US borders. And for just this survey, maybe in the future, we'll be able to open up those borders a little bit farther. And a special shout out to Nikki Monahan and the Vizslas community. Not only did you step up to take the survey this year, but you also stepped up to bring dogs into the blood draw that will help our breed in the future. So we thank you for that. On a final, I would just really love to do a encourage you to donate to the Vizsla Welfare Foundation. We need money to be able to fund these research projects, especially now that we're given some more direction on where we need to look for our research with hemangiosarcoma, mast cell cancers, those types of things. Please, if you haven't contributed to the VCA Welfare Foundation before, please do so now. Every dollar counts. We can take any amount of money. If you're interested in putting us in as a possible thing for your future and your trust, or if you should pass, we would love to tell you how to do that too. I thank you for your time. Hopefully I didn't confuse anybody, and I'll turn it back over to Elise.
Thank you, Kathy. That was terrific. I'm eager to do more. It's really, and we can do more because so many people participated. I'd like to open it up now to some Q&A. I'm sure some of you have your gears turning. We're here to field questions. Or I might call on a few. I see some folks in the audience I know.
Elise, I think we could just have people speak up now, right? As opposed
Yes.
to put in the chat. Yeah.
Yes, absolutely.
It doesn't have to be just questions about the survey either. We're interested in what you'd love to see articles about, what you'd like to see future webinars on, what interests you, what can we do for you?
There's a couple of questions in the chat. It says, was there a question about flea and tick meds? Yes, there was, but I haven't analyzed it yet. So that will be coming. It is in the Living Dog database. And then will a summary be available to VCA members at some point? Yes, it will be. Like we did with the population survey, we actually put a summary of the results on our VCA welfare website. So I'm assuming we'll do something similar to that as well. Right, Elise? I'll let you take that one.
Yes, I have a summary, a one-page summary going in the upcoming Vizsla news. And also with the launch of this webinar series, we've created a dedicated YouTube channel where that's one of the reasons why we wanted to record this evening's webinar, because we will post this webinar in our YouTube channel, and that will be hopefully a place where people can go regularly and check up on what we're doing if they can't actually make the seminar.
We have a hand raised.
Patricia Pryor.
Hi, can you hear me?
Yes.
Yeah, I just wanted to make a comment, an overview about the behavioral information. I'm a board certified veterinary behaviorist and board certified veterinary welfare person. And I love that there were questions on behavior, and I definitely would have some ideas for refining and grouping the behaviors in ways that help us identify the ones that cluster together. The point about stubbornness being a good one, that doesn't cluster with anything because it's actually not exactly a behavior problem. So it would be, I have a couple of things to add to that, which is there already is a big instrument called the CBARC that's being given, it used a lot of research and given also to a tremendous volume of pet dogs. So one really easy thing we could do is contact James Serple and see if he'll give us, or if they can give us just the Vizsla part of that to compare, even as a beginning comparison to your survey results. It's not the best survey in the world. We've modified it a lot to work with working dogs. So there's a CBARC working dog modified version and a CDOG guide dogs for the blind working. But I agree with Krista that the guide dogs know more about the consistency of behavior, and they get really good behavior information, but they're not looking quite for the same things that we're looking for, because they wash out all their dogs with much fear, for instance, and that's something that we really need to be watching for, I think. So that's just that, and it might even be possible to I'll just work with you guys. I could envision a situation where we gave a webinar that would help to sort of explain in a very general way how the different behaviors group together. You know, that aggression towards dogs is not in the same category as aggression towards people. They're not motivated often by the same thing. They're not the same problem. And so it might be helpful to get people excited about filling in another more detailed behavior thing if we chummed it up with some, look at these funny dogs. It could be funny and fun and nice, and it also could be educational, and maybe even motivate people to think about what answering a future metric.
That's awesome. We're going to come
That's
back
all.
to you to that. Thank
Yeah,
you.
great.
There are a few additional questions in the chat as well. So one question is, will there be an opportunity to complete the survey in the future? So this survey is closed, and we have a lot of learnings actually from how we built this survey and how we would do it better in the future. So we will do another full survey at some point in the future. Next year, like we said, we're talking about doing some drill downs on what we already have, but this isn't going to be the only time we sample the whole population. So there will be opportunities to be involved in surveys in the future, but this one is done. And then another question, this one from Jen Miller. I'm surprised to see the epilepsy number so low. The number of pet owners talking about epilepsy seizures in their dogs in groups is alarming, in Facebook groups is alarming. I agree. And, you know, it's interesting that we had very low numbers, but I would hope that if people's dogs actually had epilepsy or died with epilepsy as part of that cause, that they would have entered in the survey. But we really didn't see very many numbers in the survey.
I think I'm going to put in there too, for some reason, I still think there's stigma attached to it, and that people are afraid to admit that they own a seizing dog or that they've bred a seizing dog or whatever. So maybe in the future we'll just do something for about that, just calling all dogs that have had a seizure, and really and finding out more information, because
well, we could do a case control design, and you know, match some seizing dogs to some other dogs using our survey results, and kind of back into it from the end, from the dogs that actually have the disease, as opposed to asking if people have the disease. So that is an option. I think we had a follow-up question to that, though. On Facebook, so Kathy Gallagher, on Facebook, I wonder if the relationship between seizures and flea and tick preventatives or other chemicals, epilepsy. So we do ask about flea and tick medications, and we do ask about epilepsy in those same dogs. So we can always look at that as well, but the numbers are so low. And so I worry about us being able to really figure out anything from our survey, but we can certainly look at the few that we have. And then the additional question is, the long-haired gene isn't recorded by OFA, but Vizsla database will record it. Is there any way to capture that in a study as well? So we did ask about the long-haired gene in the survey. So I haven't analyzed that either, but we did ask the people who took the survey. Elise, I don't know if there's anything you want to add to that.
I'll actually add to that.
Great.
So right now we are in the process of rewriting our health statement for the American Kennel Club, and will be including the long-haired gene test as one of our optional testings. It's not a must-do thing, but it's an optional test. And what will be happening here in the next few years with AKC is, when you have those tests run through AKC, through their DNA plus health sampling, those will actually show up on pedigrees, and they will also start giving us statistics. So if we can start doing all of that health testing through the AKC DNA plus health in the future, that'll help. Right now, it is not being recorded by OFA, but AKC will be the only way that we'll be able to get actual true numbers.
There is a follow-up. Thank you for that, Kathy. There is a follow-up question on epilepsy. So by Carol, I'm curious how many pups are having seizures due to the flea and tick meds without having epilepsy. So we did ask both about epilepsy and seizures not related to epilepsy. And so we had both of those numbers, but again, they were both low. So I think the ability to really drill down and get anything meaningful from that out of our survey is not going to be great.
I just saw that Susan asked about the, yes. anything that we develop a DNA test for, we will continue to update the AKC health statement as optional testing. And they will continue to keep adding them. So yes, that will also be included as optional. We just have to write the statement, and then hopefully the Vizsla Club of America Board of Directors will vote it through. We'll send it to AKC and should be in line, hopefully, to start before the end of the year is the goal. Curious if you guys found this useful information, if you're looking forward to webinars. Great. Thumbs up. Let's see some thumbs up.
Yeah, so we'll do it again. Yes. Awesome. Well, we're at the 1 hour mark, and I think that's a good time to stop. Really appreciate giving up a weeknight to spend time with us. We love talking about this stuff on the Welfare Foundation board, and happy to expand the conversation. So look for something later in August, perhaps, Kathy, and we have
possibly
all
the
of
end
your
of July. Yeah, possibly the end of July for a puppy evaluation webinar.
Great, and we have all of your emails, which we will keep under lock and key, except when we need to communicate with you about upcoming webinars and our YouTube channel when it goes live. So with that, I will bid you all good night and thank you for joining us. We are thrilled to have you all join us this evening.
Thank you. Thanks, Elise, and thank you very much, Kathy.
Yay. Good night.